All right, welcome everybody to today's webinar. I am showing it is 11 a.m. Central Time on the dot, so in the interest of everybody's time, I'm going to get started accordingly. Just a couple of background items before we get started. Due to the number of attendees, we have muted all phone lines to eliminate background noise, and we will not be opening the lines at all during the webinar. If you do have a question that comes up, I ask that you use the chat function or the question and answer function and type that question in. If it is not addressed during the course of the presentation, I will do my best to get to those at the end. For those of you that don't know me, my name is David Lindgren. I am the Compliance Officer here at Flexible Benefit Service Corporation. I've been with the company now close to 11 years. The agenda for today, just want to give a brief overview here of who Flex is. We've got some new insurance agents and other professionals joining us today for the first time. Then dive into a brief COBRA refresher, and then really talk about the Affordable Care Act healthcare reform law and its impacts to COBRA both directly and indirectly, and then sort of wrap up the presentation with some predictions and follow that up with addressing your questions and answers. So very briefly, with regards to who Flex is, we are an agency located in Rosemont, Illinois. We have approximately 100 employees. Actually, just as of September 1st, we celebrated our 26th anniversary of being in business. So very happy to celebrate that milestone. We have three primary business divisions. We are a general agency, a benefits administrator, and we also operate our own private insurance exchange. In regards to our general agency, many of you are contracted with us in one way, shape, or form with one or more of these insurance companies, but we act as a wholesaler providing support to independent insurance agents, all the way up to larger brokerages and consulting firms that have several hundred or several thousand employees in some scenarios. We operate in the group marketplace, the individual marketplace, as well as the senior market, Medicare marketplace, and also have voluntary life, dental, vision, and other ancillary related products. We represent companies such as Aetna, Blue Cross Blue Shield of Illinois, as well as United Healthcare. And the list of carriers that you see is not an all-inclusive list on that screen, just a snapshot of some of who we represent. As a benefits administrator, we operate at a third-party level, working directly with employers, as well as receiving referrals from many folks such as yourselves to help those employers administer benefits that are tax favorable and often on an account-based platform. According to Business Insurance Magazine, we are the 9th largest third-party benefits administrator in the country. We administer cafeteria plans, flexible spending accounts, health reimbursement arrangements. We have our own proprietary health savings account, administer COBRA, as well as provide other services. We provide the plan documents, the claims administration, the customer service, the support, and many other services. Many of you have heard a little bit at least about our private insurance exchange. We refer to it as InsureX Solutions. This is really a platform primarily targeted towards smaller employers. Do have some clients at the larger level and in the retiree marketplace as well, but really a way for employers to get a simplified employee benefit platform, really taking a defined contribution, sort of fixed capped cost approach, giving employees a number of different insurance options from multiple insurance companies, both health products and other ancillary related products. We have a number of upcoming presentations and communications on our insurance exchange if that's something of interest to you. Now into the main reason for your attendance today, taking a look at COBRA and how the Affordable Care Act is impacting it. When we have these presentations, we get agents of all different knowledge levels, some that are very familiar with the topic that's being discussed, and some maybe not so familiar. So I'm going to sort of start at the beginning and give a little bit of a refresher on COBRA, and then start getting into sort of how some changes and impacts are going on with the healthcare reform law. So when we talk about COBRA, I would if I was a gambler, I would bet that several people couldn't even define the acronym COBRA. I know I've even asked some internal folks here, what does COBRA stand for? And you'd be surprised at the number of options you hear. COBRA stands for the Consolidated Omnibus Budget Reconciliation Act. It was passed by Congress in 1985 and became effective in 1986. And there really hasn't been very much change to that law since the law was passed approximately 28 years ago. And really the whole premise and background of COBRA is that it requires covered employers to provide qualified beneficiaries with healthcare continuation coverage. And I'll define those terms for you as we get a little further into this presentation. But when we talk about COBRA and why it was signed into law, one of its primary purposes was for it to prevent the so-called job lock crisis that was going on in the 80s and carried on to the 90s and really up until present day. In that in our, I'll call it our previous health insurance world, we were in a situation and employees were in situations where oftentimes to qualify for health insurance, it was contingent upon your medical background. And you would potentially have pre-existing condition waiting periods. If securing coverage in the individual marketplace, coverage could actually be declined. You could be charged a higher premium. You could have certain conditions excluded for indefinite time periods. And really, a lot of people were working at their employer for the sole benefit of the health insurance coverage that they provided. And really that person might have been more qualified or desired to make a job transition for one reason or another, but was prohibited from doing so because of their medical condition. There was a fear that they would be without coverage. They couldn't qualify for a plan in the individual market, or with their new employer, there would be a waiting period before their pre-existing condition was covered. So COBRA was used as a mechanism to allow employees as well as their covered spouse and dependents to have the ability to really have a sort of transitional time period where they can continue coverage until they were able to find another plan elsewhere. Now, when we talk about who a covered employer is, that's defined specifically as an employer with 20 or more employees on more than 50% of the working days in the previous year. So generally, if the employer has 20 or more, they're going to be required to offer COBRA to qualified beneficiaries. It does apply to both the private sector marketplace as well as local and state governments. However, it does not apply to the federal government and certain religious organizations. When we talk about the federal government, there's actually a different law, a different healthcare continuation law that applies to the federal government. Really works quite similarly to COBRA, but has some different rules and regulations. When we talk about what sort of coverage is affected, COBRA applies to health plans. And so that health plan would generally be the major medical coverage, whether it be self-funded or fully insured. So that would include the HMO type plans, PPO type plans, high deductible health plans. It does apply to dental and vision plans, as well as health reimbursement arrangements and some flexible spending accounts. COBRA does not apply to what I'll call non-health coverage. So it does not apply to things like group life insurance. If there's a long-term care policy, it does not apply to that. Short-term disability and long-term disability does not apply to. It actually does not apply to the health savings account either. Just know that COBRA does apply to the underlying high deductible health plan, but not the actual health savings account itself. Just a moment here. So when we talk about the qualified beneficiary, that, when we take a look at the regulations, is any individual that is covered by the group health plan on the day prior to a qualifying event, another term that I'll have to define here. But generally, that's going to be the employee, the employee's federally recognized spouse, and one thing to point out is, as of last year, from the federal government definition of a spouse, they now include both opposite sex partners as well as legally married same-sex partners, as well as dependent children. When we talk about a qualifying event, the really key to a qualifying event, and there's very specific qualifying events, is that the event has to cause the qualified beneficiary to lose group health coverage or lose access to that group health coverage. So that's it. When you take a look at the qualifying event, did it result in a loss of coverage? If the answer is yes, then COBRA would apply. And the type of event and the specific qualified beneficiary that is impacted will determine the maximum length of time that COBRA has to be offered. This is a table that I put together that really summarizes the COBRA qualifying events. There is one event not listed on here, and that's bankruptcy of the employer. Doesn't come up very often and generally will apply to the retiree marketplace, so I've excluded that here. But we're really talking about, these are your general qualifying events. When we take a look at the first two, those first two apply to all three of the individuals you see, the employee, that employee's covered spouse, as well as the dependent children. There must, for those first two, it could be either a voluntary or involuntary termination of employment for reasons other than gross misconduct, or a reduction in the number of hours. So it could be because of a strike or a layoff, or an employee was moved maybe from full-time status to part-time status. But if either of those first two events occur, then the employee, the covered spouse, and covered dependent children all have the option to continue coverage for up to an additional 18 months. The next three qualifying events apply to the spouse and dependent children. In a situation where an employee becomes entitled to Medicare and voluntary cancels coverage, if there is a divorce or legal separation from the employee, or death of the employee, in those scenarios, the spouse and dependent children would need to be offered the right to enroll in COBRA for up to a maximum of 36 months. And the last qualifying event is loss of dependent child status under the plan or plans. And that's just going to apply, of course, to the dependent children. A lot of times that's going to be as a result of the child reaching age 26. And if that occurs, that child is given the right to elect COBRA for up to 26 months. Now, in terms of the election of COBRA, each qualified beneficiary has an independent right to elect COBRA. So the employee does not have to elect COBRA. Just the spouse or just the child could individually elect COBRA on their own. There is a 60-day time period to elect COBRA, and that time period is measured from the date of the qualifying event or the date the election notice is sent to the qualified beneficiary, whichever is later. Now, if COBRA is elected, that coverage is retroactive, so there is no gap or no break in coverage. Generally speaking, the qualified beneficiaries are usually required to pay the entire cost of coverage and usually a 2% administrative fee on top of that. So in most scenarios, they're going to lose any employer contribution towards coverage. We do see in some instances, for example, when there is a layoff, there might be a severance package involved where the employer will pay for a portion of that premium for a defined time period as indicated in the severance package. Outside of that, generally don't see too many employer contributions towards COBRA. All right, so many of you were probably familiar with much of that information. Now I just want to get into talking a little bit more about the healthcare reform law, the Affordable Care Act as its formal name, and how it impacts COBRA. So just a short recap here. I think by this time we're probably all familiar that the Affordable Care Act was passed on March 23rd, 2010. We know that the law makes radical changes to health care in general, to group health insurance plans, and the health insurance industry as a whole. I mean, this is the most substantial law to really impact our industry, really probably going all the way back since the passage of Medicare in the 60s. So, I mean, we're talking about, the most significant law in our industry, arguably in the last 50 years. And, one thing to note, and again, this is probably not unfamiliar to many of you, but in particular, the Affordable Care Act requires issuers of individual market coverage, so an issuer is generally going to be the health insurance company, to make their plans available regardless of medical history. So there's no more rate increases for medical history. There are potential rate increases for tobacco use, but in the eyes of the government, tobacco use is not a medical condition, and therefore insurance companies are allowed to adjust rates there. But outside of that, no rate adjustments for things like high cholesterol, high blood pressure, cancer, or whatever it may be. No more pre-existing condition waiting periods, and no more exclusion riders where a particular pre-existing condition is not covered for a specific length of time, if not indefinitely. Now, of course, there are only specific times that an individual can enroll in a individual-based plan, but assuming they're in a qualified enrollment period, they cannot be refused coverage. So, going back to where I started our presentation, I indicated that COBRA, at least in its original intent, back in 1985, was signed into law as a means to alleviate that job lock condition that I was referencing. And so now many people are questioning, well, what is the Affordable Care Act's impact to COBRA? Because people can now go out in the market and get their own coverage, and it won't be denied, and there's no waiting periods, and they can't be rated up, and there might even be cheaper or better options available in the individual market. So does COBRA really even apply or make sense anymore? And the Department of Labor realized that several people had these questions and these concerns about COBRA, and I want to say it was back in 2012 sometime. I can't remember the specific date or the specific month, but I believe it was in 2012 the Department of Labor posted some comments on their website, and this is just a sort of synopsis of those comments. And they indicated that as it pertains to the rules and regulations of COBRA, COBRA has not been eliminated, nor has any of its regulatory provisions been changed. So that means when we talk about COBRA, all the same rules and regulations apply. So, we still have to, employers have to still be aware of the qualifying events and the qualifying beneficiaries and the length of time that COBRA has to be offered and the certain notices that need to be provided and when. So all of this still applies. So while there are no direct changes to COBRA, there are several indirect changes as a result, and I want to read through or go through some of those changes with you. So first is in regards to the notices. There's several different notices that must be provided to qualified beneficiaries when a qualifying event occurs that results in a loss of coverage. And the first notice that I want to talk about is, the regulations usually refer to it as a general notice. The industry usually talks about this and refers to it as the initial notice. And this is a notice that is supposed to be provided to an employee as well as their covered spouse within the first 90 days that they enroll in their health plan. So, just think as an example, a newly hired employee, once they enroll in the group health plan, this general notice is provided to them. And if that employee is also covering their spouse, a general notice should be provided to the spouse as well, because keep in mind the spouse will experience potential events that are specific to themselves, such as a divorce or death of the employee, in which COBRA only applies to them. And really, the general notice is an outline of the COBRA rules, tells employees what their rights are if certain situations happen that would otherwise result in a loss of coverage. And that general notice was updated by the Department of Labor. They actually put a model notice out on their website. They actually put a model notice out in 2013 that required some additional information to be included. But then again, this past May of 2014, they came out with a newly revised notice that really requires the COBRA notices to talk about alternative coverage options that are available through the health insurance marketplace, or what we refer to as the exchange. And so there's some model language that's out there in the notice. Employers don't have to use that notice, but that notice would be what we call a safe harbor notice, which means it would satisfy all of the notification requirements from the employer to the employee that should otherwise be included in that general notice. And then there's the election notice, which is really probably one of the most important, if not the most important, COBRA notice that exists. And this is the notice that's given to the qualified beneficiary after a qualifying event occurs, which results in a loss of coverage. The general rules are this notice needs to be provided within 14 days of a qualifying event, or at least of an employer being informed of a qualifying event. And that's not new. Timing has always been true. So that's not changed with with the Affordable Care Act. But again, what needs to be included is a lot of information about the alternative coverage options available through the health insurance marketplace, and what was really added in more depth as of required in May was more detailed information about special enrollment rights through the health insurance marketplace. That also needs to be included. As we discussed, individuals can't be declined coverage based on medical history, but there are limited time periods in which they can enroll in coverage through the marketplace or the exchange. Now, when we talk about the exchange options itself, we know enrollment can only be done at certain times. The annual enrollment period is fastly approaching. It's November 15th of 2014, and that runs for about a 90-day time period to February 15th, 2015. And outside of that, there's special enrollment periods that almost all of them, I can only think of one that's shorter than this time period, but almost all of them are going to be a 60-day time period upon experiencing a qualifying event. And of course, one of those qualifying events is a loss of minimum essential coverage, a new term that we're using as a result of the Affordable Care Act. That's going to give special enrollment rights to those qualified beneficiaries. So in a situation, I'm going to use an employee losing their job as an example, whether they quit or were fired or whatever the reason was. But that seems to be one of the most common events that comes up when we're talking about COBRA. Let's say that an employee loses their job, and as a result, they're going to be offered COBRA. Well, they don't have to take COBRA. They can, of course, explore the marketplace. And if they do want to enroll in an individual marketplace plan, whether on the exchange or off the exchange, they're going to have a 60-day special enrollment period from the date of that qualifying event. And if they choose not to enroll in marketplace coverage or exchange coverage, and they choose to elect COBRA instead, they're going to have a 60-day special enrollment period after the maximum coverage period has been exhausted. So, one thing to really be aware of is that if somebody takes COBRA and, let's say, somebody enrolled in COBRA in March, July comes around and they decide, I don't like the COBRA coverage, or the COBRA coverage has gotten too expensive. I just want to drop that plan and get something else. That's not going to be a qualifying event. They would have to wait till the next annual enrollment period, or they can continue on their COBRA plan for the maximum duration, usually 18 months or 16 months. And once that time period has expired, that will create another special enrollment period of 60 days. So really, you can take that 60-day special enrollment period, right at the beginning of the qualifying event, or if COBRA is elected, you take it after the maximum COBRA coverage period has been exhausted. So, sort of the main takeaway there really is that voluntarily terminating COBRA does not give somebody a special enrollment period. Now, when we talk about subsidies and the ability for employees or former employees, for that matter, to have the ability to get either the cost-sharing subsidy and or the advanced premium tax credit to help reduce their premiums, certain situations come up when we're talking about COBRA. So first thing we gotta take a look at is who actually enrolled in coverage and who did not. Generally speaking, a qualified beneficiary who enrolls in COBRA coverage is still eligible for exchange coverage. So I don't foresee that actually happening in very many situations where somebody would take COBRA and then also go out to the exchange and have an individual plan. It's two different health insurance plans that, and two different premium payments that probably wouldn't make much financial sense to most. But it's not prohibited. So one thing you have to ask yourself or ask the potential prospective client of yours is whether or not they're going to enroll in COBRA. If they do enroll in COBRA, that will eliminate their eligibility for subsidies in the exchange. When you are enrolled in other minimum essential coverage, which COBRA would fall under that definition, that eliminates subsidy eligibility. Just like if an employee was enrolled in Medicare, they couldn't get subsidies, or Medicaid, they couldn't get subsidies, or their spouse's group plan, they couldn't get subsidies. So if they want to potentially preserve their subsidy eligibility, they do have to forego and waive COBRA, and then of course meet the other eligibility requirements to obtain the subsidies, such as having household earnings within 400% of the federal poverty level, which is roughly $45,000 for a single person, $94,000 for a family of four, just as an example. Now, a couple other things to discuss is the employer shared responsibility, what's more commonly referred to as the employer mandate, and this is a highly controversial topic or rule and regulation that there's both proponents and opponents of its applicability, but as it stands today, it is scheduled to take effect in 2015 and then be fully implemented by 2016. Again, that's barring any other delays, changes, or other adjustments to it. So as it stands today, starting in 2015, employers that have 50 or more employees, and that includes a full-time plus full-time equivalents, must offer minimum essential coverage to employees, which is considered affordable to avoid employer shared responsibility payments. It must also provide something referred to as minimum value, but that's not necessarily relevant for this slide we're talking about. But when I have in parentheses there the 9.5% rule, really to protect this employer that has 50 or more employees, to protect them from any risk of penalties. They need to be offering, major medical coverage to their employees, and the lowest cost option that's available to their employees. Those employees cannot be charged more than 9.5% of their W-2 wages, or that employer potentially risks paying some penalties as a result of this new shared responsibility requirement. So one question that's been asked is, okay, I understand that there's coverage requirements for my active full-time employee population, but what about those former employees, or any employee that has sort of lost eligibility status for coverage, possibly as a result of a reduction of hours or other reasons. So what are the premium contribution requirements for COBRA? And if we take a look at the regulations, which talk about some of these penalties in the IRS code, it's section 4980H. It says there is an affordability safe harbor that exempts COBRA from contribution requirements. So, in other words, to sort of simplify that, there are no premium contribution requirements to COBRA required of the employer, and assuming they don't make any contributions, they do not risk any potential penalty for the COBRA-specific employees and or spouses or children. So just keep that in mind, and I have an asterisk there, really talking about the size of the employer. As part of the transitional relief, employers that have 50 to 99 employees, they're generally going to be exempt from the employer mandate until 2016, as long as they can attest and meet certain requirements, such as indicating they did not reduce their workforce size for the sole purpose of delaying the impact of the employer mandate to their own entity. Now, some predictions, and then we'll get wrapped up a little bit early here and take questions. Really, let's talk about the future of COBRA. So we're in a rather unique situation right now, and I think we're all still learning how everything's going to play out, in the individual market, small, large group market, the health insurance industry as a whole. It's sort of still too early to really know where we're going to be 3, 4, 5 years from now, but I do have some data I want to share with you. But a lot of it, when we're talking about COBRA, we have to take a look back. Again, the law is about 28 years old and hasn't really been adjusted since that time, and we are in an environment now that is completely different than we were 28 years ago, or let alone completely different than we were last year. And now we're in a situation where we're taking a look at COBRA and how many people will actually enroll. We talked about the individual market plans are guarantee issue. You just have to make sure you are in a time period that allows you to enroll. So either the annual enrollment period or a special enrollment period, and the loss of coverage, loss of minimum essential coverage will result in a 60-day special enrollment period for, COBRA qualified beneficiaries. Presumably, the individual marketplace will have several cheaper alternatives to COBRA, and the individual market plans now have similar benefits to that of group market-based plans, with the requirement that they now all include the 10 essential health benefits with no annual or lifetime limits. So, for most, there's going to be cheaper alternatives, maybe not necessarily for all, but cheaper premium alternatives. And some data that I extracted from some IRS regulations that were actually specific to the individual mandate, maximum penalties apply. They did reference a national average premium, and this is for a bronze level plan, but the national average premium throughout the entire country for a bronze level plan is $204 per month per individual. So just to give a ballpark, an individual purchasing coverage, single only coverage, might be able to find a plan for $204 per month. It'll be a bronze plan, so may not necessarily be as rich in benefits. Might have a higher deductible than the employer plan, or a higher out-of-pocket cost, or maybe not the same network. But from a premium perspective, $204 per month is the average. And from a COBRA perspective, we usually see premiums for single-only coverage somewhere between $600 and $800 per month for many individuals. So there are plans out there that are cheaper from a premium perspective, or usually are, and that $204 per month is also prior to any subsidy. So if somebody is subsidy eligible, I believe more than 80% of people that enrolled through the exchange qualified for a subsidy. Again, income is a requirement. If somebody is COBRA eligible because they lost their job, they may be experiencing a change in income as well, which might make them subsidy eligible. So, a lot of cheaper premium options do exist. Another positive aspect about individual coverage is that it can be extended indefinitely. It's not canceled after an 18-month time period or a 36-month time period. It can generally be kept as long as the individual wants and likes the coverage and continues to make their premium payments. And, by enrolling in COBRA, your access to subsidies are eliminated. So many are going to say, I don't want COBRA because of my ability now to get a subsidy in the exchange. So I have some election rate trends going back to 2009, and then going up to May of 2014. It takes a few months to get the most up-to-date election trends, because there are 60-day time periods where people can enroll in coverage, and there's some grace periods and other timing requirements. So this is probably the most some of the more current election trends you'll be able to come across as a result. But if we take a look, going back to 2009, the number of people that elected COBRA was, in the mid-30 percentile, so 35, 36% of people were enrolling in COBRA. We also have to realize at that time there were also some benefits provided by the government as a result of the American Recovery and Reinvestment Act, or RRA, where the federal government was paying for a portion of COBRA premiums when we were in a pretty tough time in the economy. But those election rates were substantially higher, 4 or 5 years ago. And we take a look at where those trends are going, it's clear it's a downward trend. And we know in March of 2010, the Affordable Care Act was passed, and you can see it just gradually goes down. Where after 2014, now these election trends going through May show that the number of people electing COBRA has gone now below 10%. We're seeing election trends right around 8% right now. And the source of this information comes from a company called Beneficiary, who deals with about 4 to 6 million qualifying events in any given year. They're an administrator for large employers as well as many insurance companies. So we have a number of different qualifying events. So I think this is a very accurate portrayal of election rates today. And just sort of a year-over-year comparison, remember, keep in mind, starting with January effective dates, those were the first effective dates where everyone had to be issued individual market coverage regardless of their pre-existing condition. There's a substantial reduction 2013 to 2014. It was actually the total number of people that elected just year over year that elected COBRA was reduced by 25%. So we see those numbers, sort of hovering, between 8 and 9% right now. And the big question is, where will they ultimately end up? And with so few people now electing COBRA, what is the long-term, outlook for COBRA? So when we look at today in the marketplace, these are, this should say probable COBRA enrollees, but these are people that we think still might be inclined to elect COBRA. Most certainly, people that are receiving a severance package as part of a layoff. In that scenario, COBRA might be a more affordable option for them because the employer is continuing contributions towards that coverage. In addition, any individual that has met all or a significant portion of their deductible might be inclined to keep that plan, maybe not necessarily for the full COBRA time period, but they might want to take it through the end of the plan year, especially if they're going through any sort of ongoing treatment. Some older qualifying beneficiaries may not have as many cheaper alternatives as their younger counterparts. We do know there were some compression of age brackets in terms of premium ratings, where now an older person cannot be charged more than 3 times that for a similar plan offered to a younger individual. But still, 3 times difference can be a substantial spread. And so some older individuals, people maybe in their late 50s or early 60s that are losing coverage might be inclined to take COBRA. I don't know that there's a very intelligent way to say this, but anyone that likes their coverage and can continue to afford their COBRA payments, they might be inclined to take COBRA. Again, maybe somebody undergoing current treatment, or provider networks. If you really like the network of doctors and hospitals, pharmacies, and so forth, might be inclined to take that COBRA plan. And then we also have to realize, when we think about COBRA, I think the assumption, myself included, always kind of first thinks about health insurance. COBRA is health insurance, but COBRA applies to dental insurance, vision insurance, flexible spending accounts, health reimbursement arrangements, and other health-related coverage. So there might, while people may not necessarily elect COBRA for the major medical health plan, they might elect it for some of these other benefits. So we have to sort of keep that in mind too. So just a couple final comments. I think, at least for the foreseeable future, it's safe to say that COBRA and the Affordable Care Act are going to coexist. The big question, we know election rates are on a downward trend right now. Where will those election rates, flatline, or will they ever flatline? Meaning, will it level off at, where about 5% or 4% of qualified beneficiaries are actually taking coverage? And as a result of the lower election trends that are occurring, is the Department of Labor or are the regulatory agencies ever going to sort of revisit the statute and either eliminate or make adjustments to it? For the foreseeable future, they've said no, they are not planning on it, but will that time ever come? That's sort of the million-dollar question that we really don't have the answers to. But when we talk about administering COBRA, whether that employer is doing it themselves, whether they are contracting with a third-party administrator to help with that, really sort of the general rule is you should be staying the same course. Offering COBRA, providing the required notices, allowing people to stay on that plan for the 18 or 36 months. So really sort of stay the same course for now. With that being said, I'm going to give you our contact information. If you have any questions really regarding our administrative services of COBRA, that would be our Flex Plans phone number that you see. If you have questions related to our general agency and the health insurance companies we work with, you'd call that general agency number. Our private exchange, you'd call that number. You may also visit us at our website or any of the mainstream social media outlets we do have a presence on. If you do have a question and you have not had a chance yet to type that in, please go ahead and use your chat function. Type that question in. I will get to as many as I can. Please note that if you do have a very specific and unique question regarding maybe a particular group that you work with, I'm not going to address those at this setting, but I will try to have someone from our office reach out to you regarding that. But if you have general questions related to this, by all means, please go ahead and type that in right now. Just going to read through these. There's a question: if a small business decides to no longer offer health insurance, what COBRA offering do they need to provide, or do they? So first of all, COBRA only applies to those employers that have 20 or more employees or had 20 or more on at least 50% of the previous working year. So you got to realize, so COBRA generally applies to 20 and up. So there is no COBRA requirement to those under 20. But based on the state the employer is in, there may be other state continuation requirements that may apply, such as here in Illinois, generally have to provide coverage for at least 12 months. But if an employer, whether they are large or small, is canceling coverage altogether, that means both active employees as well as anyone on COBRA would be losing their coverage. So there is no COBRA requirement if coverage is being canceled. And then there's a sort of a second part to that question. Can they just tell their employees to go to the public or private exchanges? That really is their preference. If they're going to be canceling coverage, it might be a nice courtesy to let those employees know that there's these exchange options out there. But that really is their preference. No obligation, no requirement to do that, but might be a nice thing. There's just some clarity on the subsidies. It's just clarification of whether or not somebody, if they enroll in COBRA, they are not eligible for coverage on the marketplace. If they enroll in COBRA, they still can enroll in coverage through the exchange. It's just if they enroll in COBRA, they are not eligible for a subsidy. So somebody can have coverage through both COBRA and the individual marketplace. Probably won't come up very often, but if you have COBRA, that will automatically eliminate your eligibility for a subsidy. There is a question, just clarification on the employer mandate. I thought it was applies to 50 or more employees starting in 2016. For most, that is correct. So the employer mandate will generally apply to 100 and up in 2015 and then be extended to 50 and up in 2016. You just have to know that if an employer has 50 to 99 employees, they have to qualify for an exemption from the employer mandate in 2015. And generally, that's going to require that employer, to attest that they did not, reduce their workforce size for any reason other than a bona fide business reason in order to delay the enforcement of the employer mandate. So just sort of keep that in mind. So if an employer, let's say, had 103 employees and they want to get rid of 5 of them, so now they have 98 and they're less than 100, as long as it's for a bona fide business reason, that's okay. But if it's not for a bona fide business reason and they're just trying to get under that 100 mark, get within that 50 to 99 bucket, that's not going to go over well with the IRS. So they're going to have to attest to certain things in order to be exempt from the employer mandate for 2015. There's a question for the average premium that I quoted, the $204 per month. What was the average deductible? I don't have that information. That was not published by the IRS. The only thing I can tell you is that $204 per month was the average price for single-only coverage for a bronze-level plan purchased in the exchange. We know those bronze-level plans have 60% actuarial values. When I look at those plans from a PPO perspective, you're usually at a bronze-level plan probably getting somewhere around a $5,000 deductible. Again, the deductible might be higher than the deductible offered by the employer, but that premium may be substantially lower to justify that. Okay, just reading through. There is a couple comments or questions about people looking for copies of the presentation. I'll ask our marketing folks to get some of these slides out for you. Let's see. Okay. And I think I'm just going to check. Otherwise, I think that covers most of the questions, if not all of them. So with that being said, I think I'm going to go ahead and call it a wrap and thank everybody for their time today. I hope you at least picked up a few pieces of information. I know sometimes it's hard to retain all of this new information with the healthcare reform law, and sometimes it's easy to overthink things or get mixed up with certain things. So hopefully, if you didn't learn anything, this provided a little bit of clarity. But do appreciate your time today. If you do have questions or comments, please give our office a call. But thank you very much, everybody, and good luck during the open enrollment season that's coming up. Take care and have a wonderful day.